Hi, this is Dr. Richard Bush, and this is the next installment of our video blog for theamericanchiropractor.com. Now, today I have with me Rachel Meisner. She's been with us for the last 14 years at the Bush Chiropractic Center. And we're going to talk about some of the different things that we do here, but I want to make one comment real quick, and that's in the last installment we talked about why it's so important to make sure that the doctor has confidence and the patient has confidence in the doctor. And it's not just the fact that it's important for the doctor to have confidence. It's not just important for the patient to have confidence in that doctor. It's important to understand that there's a reason behind that. And that reason behind it is if the patient has confidence in the doctor, they're going to get better quicker. What we're doing is definitely for the benefit of the patient, and that's why we're going to start talking about the first new patient phone call and how it's handled. And basically because from the beginning of that phone call all the way through, even through the first visit that the patient has in your office, you're actually crafting that patient's idea and understanding about what is taking place, how they're going to get well, why they're going to get well, and this is all to the benefit of the patient. If the patient isn't going to get well in your office or they don't believe that they're going to get well, they're just wasting their time and their money. So it's very important to make sure from the beginning that we actually get control of that. Now, Rachel, as we talk about some of the different things that we do, what are some of the more important things that you're taking care of when you get the new patient phone call?
When you initially take that first call, you absolutely want to gain control of the conversation. When the patient calls in, you want to be able to ask the questions, prompt the patient, get the information that you need, because you want control, good control, from the start of the conversation.
Just a second,
Sure.
I'm sorry not to interrupt. Why is that so important at that point?
Well, when the patient calls in, basically you're giving them an explanation of what's going to happen when they come in, how everything is going to work, and then when they come into your office, basically what they're doing is they're seeing what you explained to them on the phone. So on the initial phone call, they can actually visualize how their first visit is going to go, you know, what's going to happen. You're kind of taking the anxiety out of it.
You know, when you're doing that also, you're also doing some things to make sure that you're kind of promoting the doctor in the patient's mind, aren't you?
Absolutely. When you're talking to the patient, you know, patients calling in, you know, they may be very uneasy, they may be scared. You know, a lot of the patients, you know, have been to other facilities, they've maybe had a bad experience somewhere else, and what you're doing is you're actually building the doctor's reputation. You know, if somebody's calling in and, you know, I've been everywhere, I've done everything, what you want to let them know is that they are going in the right direction. They need to be at your office, and this is the best place for them to be. You know, and if doctor can help them, great, he's going to let them know that. If not, then he's not going to be treating them, and he would let them know what to do from there. So you're really reassuring the patient before they even come in that yes, this is the place that they want to be.
And you know that whole saying of tell them what you told them, or tell them what you're going to tell them what you told them, and then
do what you told
them. Do what you told them. Is that
correct?
Right? Okay.
Absolutely. So when a patient calls in on that first call, you're obviously explaining, you know, this is how we do, you know, the first visit. This is what's going to happen on the first visit. This is how things are handled. Then you're going to have a second visit. They can visualize all that, and then when they come in your office, you do everything exactly as you told them on the telephone. So obviously you're disarming that patient throughout the whole process, and you're doing exactly what you told them on the phone, and that way there aren't any surprises, which is actually going to help to put the patient at ease, which obviously helps the process.
Not only that, but it also takes their mind off of all the other things that may go wrong out there and allows them to focus themselves on the fact that they're here to get well. And so when it comes down to that first new patient phone call, can you give us a couple of strategies on different things that we may want to implement so that, or some of the doctors that may be listening might want to do or to train their staffs so that their staffs can actually start to repeat the same things that you're talking about?
Sure. What you want to do is when you're initially speaking to the patient, you want to get some information from them. You need to find out, you know, about their condition. You want that patient to recall That's a big, big key. You want them to recall their pain. Maybe at the moment that they're calling in, they're not hurting as badly as they were yesterday. So you want them, and by basically saying, what does your condition feel like when it's at its worst? They need to recall that pain so that they understand, okay, I do have a problem. You want to use fluxes in your voice. You may ask a question like, somebody says they've got a leg issue. Has it reached your foot yet? Those are questions that you want to ask because, again, you want to remain in control. You want to find out if they've had x-rays or MRIs done. Obviously, that's going to help you in terms of explaining their first visit, whether or not you would be doing films for that
the other
patient.
thing I think that you're doing when you're asking those questions like that is you're also making sure that you're getting the entire patient situation so that, there are a lot of times when they tell you something on the phone and when they go through their new patient processing, that when I have them back in the conference room and I'm doing a case history, I all of a sudden find out that they have other things or other issues going on because my script or the way that I asked questions is a little bit different than what you do.
Correct. But you always want to be very thorough. You don't want to rush with the patient. You want basically to get that patient's whole, history at that point. Treatment that they've done, conditions that they have, medications that they're on. You want to know all those things because that in turn is going to obviously help you stay in good control, and then you're also exactly helping to preempt the doctor for, okay, this person has this problem, but they also have this as well. It's nice to be able to go right to Dr. Bush and say, okay, Dr. Bush, this patient has a fusion, so that he's aware of it, and go forward from there. So you just want to be very detailed in that initial call with the patient and get as much information as you can, to help the whole process.
And at the same time, as we talked about earlier, it is vital to make sure that you're building that patient's reputation all the way along, or that doctor's reputation all the way along the way, because it does help give the patient more confidence, which in the long run is better for the patient because they're going to respond better, they're going to do what the doctor asks, and they're going to get the results that they really truly need and desire. Now, if you have any questions, please make sure you email us at info@allcashpractice.com. That's info@allcashpractice.com, and we'd be happy to answer any questions that you may have. And the nice thing about questions is they really prompt us to know what is on your mind, and we can tell you how we handle things in our office. And the phone is ringing, so you know what that means? We got to get going. Thank you very much. Have a great day. Again, I'm Dr. Richard Bush.